Hello and good afternoon. Did you know that bipolar disorder is the leading cause of disability, one of the leading causes? The World Health Organization says that globally it is the 5th leading cause of disability among individuals aged 15 to 44 years. Many people might think, isn't this just a mental issue? It couldn't have any physical effect, right? Well, it's actually quite the contrary. In fact, the World Health Organization continues that it's the 9th leading cause of life lost due to either death or disability. To me, these stats are quite upsetting personally. As somebody who has a family member who struggles with bipolar and had to go on disability due to this was a very upsetting thing to see. Today, I will discuss bipolar. Firstly, the need for reforming treatment, accurate diagnosis, and increasing awareness around it. Secondly, I will say the ways of how we can solve this. And lastly, I will persuade you to possibly improve your awareness and hopefully maybe donate. Bipolar disorder has a lot of substantial need of ways to reform it and how it's treated. One of these problems that exist with its treatment is a high level of misdiagnosis. Often, people who have bipolar depression first show symptoms of MDD and then later show symptoms of bipolar. If it's later treated, it could be ineffective due to proper treatment not working as well later on. In an article on psychiatryonline.org, they say that if treatment is not immediately done, proper treatment, it may be less effective. Many are aware of misdiagnosis, but they still do not use depression scales to evaluate it properly. On an article called Bipolar Depression, Real-World Perspectives, many clinicians said they were aware of the misdiagnosis, but despite this did not use tools to screen for history of mania in patients presenting with a depressive episode. In fact, the scales themselves also have a lot of limits, for the fact that they are mostly focused towards MDD and can be based on certain socioeconomic status and not towards different groups of people. Lastly, they can also have ineffective treatments that they will prescribe, such as certain antidepressants, which are more based towards MDD. In the same article, they said half of the clinicians who participated prescribed a combo of mood stabilizers and antidepressants, despite evidence that traditional antidepressants are not effective. Another problem for this is the negative effect on society it causes. One of these causes could be emotional turmoil within family members. An article on dubpress.com says that bipolar disorder patients could pose a risk to their family and friends, maybe eventually even leading to their own suicide. In addition, it can cause personal financial distress for the person. In the Journal of Bipolar Disorder, Improving Diagnosis and Optimizing Integrated Care, it says that people with bipolar are less likely to succeed at work and academically. Also, there is a large cost for bipolar nationally. In the Journal for Psychological Interventions for the Management of Bipolar Disorder, costs combined from loss of employment, loss of productivity, sick leave, and uncompensated care cost the nation $120 billion every year. There are also external problems that have besides external problems, there are also internal problems that negatively affect the person directly. One of these is increased suicide rate. The same journal continues that up to 50% of patients attempt suicide at least once, and up to 20% will die by suicide. Another negative effect the journal continues is that without proper treatment, the patient will have poor symptom control, especially if there's any type of delay in the diagnosis. And the last problem that exacerbates all of the previous ones is the stigma around depression. Stigma causes all of these issues to persist. With their stigma in the family, it can cause a hostile environment. Stigma in the workplace will cause discrimination and financial distress. And stigma in medicine causes lack of funding for this type of research and prevents new and more effective treatments. Despite this problem, there are ways to fix it, and these usually fall into 2 categories: to reform the treatment and to educate people. One of the first ways to fix this is using bioindicators to diagnose. Looking at family medical history, usually there's some kind of genetic link between bipolar depression. Family history can indicate if somebody is more or less likely to have it. Also, genetic indicators, specifically RNA biomarkers. An article called The Game Changer in Diagnosis of Bipolar Disorder using RNA editing-based biomarkers shows that 6 they found can help discriminate between unipolar and bipolar depression. In addition, lymphocytes, which are a type of white blood cell, specifically in this case T and B cells, can indicate the type of depression as well. Research in the frontiers of psychiatry showed that certain levels differed between MDD and BD, and it was a way to verify diagnosis. Second way we can fix this is through pharmaceutical treatments. We need to find new treatments that won't cause instability in people with BD, like the current antidepressants that are used for MDD, because usually that have been prescribed first. The third way we can fix this is through therapeutic means. One of these can be CBT. This helps to recognize personal symptoms, learn how to be okay with these symptoms, and learn how to combat these symptoms to prevent relapse. Another one is FFT. That helps the family to maintain therapeutic practices at home to keep the person healthy. And another one is ISPRT. This helps the person to keep a consistent social rhythm and prevent relapses through new distresses in life or changes. And lastly, and a very big one, would be specific bipolar depression scale. Currently, we have major depression scales, but we don't have some things focused on bipolar depression. If we had a specified one, it would be able to account for patients' socioeconomic differences, different symptomatic changes they can exist, and prevent people who have first MDD symptoms to not get the proper diagnosis. Also, by increasing psychoeducation, we can help to reduce the stigma. By reducing stigma, patients will be more open to treatment, and there will be less isolation with family members and stronger social connections. Also, families will help to be better prepared. They can be more aware of side effects, maximize the therapy benefits at home, look out for warning signs, and help to prevent relapses. If this all came to fruition, the world would benefit in so many ways. Families would be happier and more hopeful for recovery, and finally they can maybe hear the laughter of their loved ones again. Also, in addition, the amount of money we would lose nationally and internationally would reduce dramatically. And most importantly of all, the well-being of current and future patients with BD would increase dramatically, and suicide rates would go down as well. For these people who are suffering, hopefully the world would become brighter, and the burden would lighten on their shoulders from being able to be better. Who wouldn't want this world? As you can see, there is a strong need for the reformation of treatments and to improve awareness of bipolar depression. Even if you don't know anyone in your life who has it, or know any family members who has it, you can still be largely affected by this. Despite what you may think, it may be very possible there is somebody you know in your life who is silently struggling, willing for things to get better. For their sake and the world's sake, please improve your awareness, reduce the stigma, and if you can, consider donating. Today on the board, I wrote a link to the American Foundation for Suicide Prevention. Every year they host an Out of the Darkness walk, and it usually takes place around September, which is Suicide Prevention Month. And a lot of these are taking place in Illinois. If you have any interest in going, it is fantastic. I have been before, and it's a great way to meet other people affected by suicide and to get better. I would very much recommend going at least once if you ever get a chance. If you can't do this, or if it's not your speed or too much for you emotionally, which is completely fair, please consider donating. Any amount will help. Thank you so much for your time.